Hey everyone, welcome back. We're in the marshes today. Can hear some bugs chirping in the background, some birds maybe. It's just a nice watery marsh. So today, what I want to touch upon is the idea of permission and how it pertains to moral dilemmas and moral injury. In medicine, especially Western medicine, the way we practice modern Western medicine, we often run into situations where we're running out of options of what we can do for people in the hospital. Oftentimes, these are people that are stuck in the ICU or they're just stuck in the hospital somewhere and there's nowhere for them to go. They can't go anywhere because they're too sick. And the moral injury, the moral dilemma often arise from the healthcare workers that are taking care of these people because they come every day and they see the person every day stuck in bed, usually quite depressed, usually suffering in some way, shape, or form, whether it's physical, emotional, or spiritual. And they feel trapped. They feel like they've lost control. And we as healthcare workers can sense that, we can see that. And that causes a lot of moral injury and moral distress. And we often ask ourselves, what are we doing here? What are we doing for this person? What are we doing for these people? And there's a strong sense of humanity there underlying those questions because we all came into the field wanting to help people. And so when we perceive that we've done a lot for people and the more we do, the sicker they get and the more unhappy they get, the less healthy they get, it really makes us question our values as a healthcare worker because we feel like sometimes we're prolonging people's suffering. We are extending, lingering, where otherwise, if left up to a natural disease progression, these people would be dead. And just to be clear, there is no one right or wrong answer to answer every single case of these. But I do want to explore some of it because there's a subset of patients where the process is actually stuck in a phase of awaiting permission. Usually, it is the healthcare team that is awaiting permission from the patient once they have gone through their journey and suffered enough, they at some point, and everyone's different, everyone's point of their threshold is different, and they will tell us, I don't want to keep doing this anymore. I'm ready to die. I want to die. Now that doesn't make it any easier to hear, to be honest with you. We don't just go, oh, thank God this guy or this lady is ready to die. We've been hoping for her to, or him to die. No, it's not like that. It's more so, damn, after all that time, I'm glad your suffering is about to come to an end. The silver lining is being able to change the course of treatment and what we do for people during those last few hours and days of their lives by switching from the standard, everyday, regular old medical care where we poke people, take vitals every 4 hours, we give them all these medications that are frankly not even benefiting them anymore. We transition from that to what we call comfort measures. And comfort measures is exactly like it sounds. And there's no set, the beauty of it is there's no set regimen of what comfort measures even is. So everyone's idea of comfort and everyone's feeling of comfort is different. Everyone's needs at end of life are also different. So the beauty of comfort measures is the medical team can actually realign their goals of helping people with providing comfort care and really watching as someone goes from agony and suffering and depression and anxiety and fear to peace, calm, comfort, love, spending time with their families, and most importantly, not struggling with fighting the natural progression of life towards death anymore. And I've seen so many of cases at this point, and each one I would say is beautiful in its own way because it has to happen to all of us. And that moment of acceptance when we understand that life here must end so it can start elsewhere, when that is accepted, we also start feeling more at peace with what we're doing because then we realigned ourselves with the idea that we're helping people again. And that's what it's all about, is the transformation of hope. So going back to permission, sometimes this permission has to come from people who are dying themselves, and that's sometimes a hard subject to talk about. And that's why my job really exists as a palliative care doctor. I specialize in having these conversations with people. But sometimes people are also ready. Sometimes people know when they're dying and they tell us, I am ready. I don't want to keep suffering. There's no point for me to keep trying to hang on when all I do is suffer. There's no quality of life. I'm ready. Help me out. And I think there's a good enough amount of people with that mindset that now several states, including New York, most recently have legalized medical aid in dying or MAID. And that's certainly another subject we can delve into some other time. For today, sticking with permission, getting permission to proceed with end-of-life affairs from the person who's dying is difficult. And sometimes, I would say a lot of times, getting permission from the family members and the loved ones of people who are dying is even harder. I can't prove this, but I have a suspicion it's because when we're not dying, we don't know how that person is feeling. And it's hard to put ourselves in the shoes of someone who's dying because we don't know what that's like and we fear what we don't know. So we get scared and ask questions like, are they gonna choke to death? Are they going to be hungry? Are they going to feel like they're thirsty? Are we just starving people to death? So you're not going to give any life-saving medications, so you're just going to give up, and these questions are all valid. They are all valid because we have not been taught as a whole, as a society as a whole, we have not been taught how to prepare for dying. And so I don't blame anybody for asking these questions. And so there are various ways to address these, and I'm not going to go into them, but that is essentially what my job entails. However, I will touch upon sometimes the necessity of patients and people who are dying, how it is necessary for them to hear from their loved ones that it's okay. We know you're leaving us, but it's okay. If you do not want to continue lingering and suffering like this, we understand and we support you. And again, I think that's such a beautiful thing whenever I see that happen, because nothing hurts more than hoping that death can be staved off, and then death time and time again proves us wrong. Nothing hurts more than that disappointment when you expect the doctors to hold death off forever and fix your loved ones so that they may walk again, they may go home with you again. And this is a tough subject. This is a tough thing to even wrap your head around, and I'm still wrapping my head around it. But when I see acceptance from loved ones supporting their families, going through the death and dying process, I think that's a beautiful thing as well, because then almost immediately you see a release of tension as well on the person who's dying. They've been carrying this burden. There is this burden to perform, to get better. And if I don't get better, I'm letting my family down, I'm letting my loved ones down. And then when you give people permission to die, suddenly they don't feel that burden anymore. And conversely, I have also seen cases when, out of fear, out of not wanting to let people go, families have insisted that we continue doing everything, everything that we can to keep the person alive. And we're not God, we're not magicians. We can't achieve that. So inevitably, we feel like we let the patients down. We feel like we let the families down. The family feels, studies say that the family feels regret afterwards usually. If they had known that the person was going to die that soon, they would have done something different. And I do wonder, do the patients that die when their families aren't ready to let them go, I do wonder if they feel also like they let the loved ones down. So in essence, I'm saying that permission is important, and this is something that if you're dealing with in your life, consider it. It could be the best gift you can give to your family member or your loved ones before it's the last time you ever see them again or talk to them again. So let me know if you've had experiences with having to give permission, or You've had experiences where permission was not given and then resulted in a lot of moral injury and moral trauma and regret. So, gloomy day, gloomy setting, perfect place to talk about this subject, I think. Thanks for joining me. I'll see you on the next one.